my name is Enos and this is Work and Wonder. Welcome back to my channel. If you are a returning subscriber, you are welcome. If you're a new subscriber as well, you are welcome. And if you are seeing me for the first time, my name is Enos and I talk a lot about the mental health nursing Osce. So if you are a candidate or you are an individual who is preparing for his mental health nursing Osce, I can guarantee that this is the only YouTube channel that talks about the mental health nursing Osce. So you are welcome. Please feel free to click the subscription button and then turn on the notification bell, and anytime I upload the video, of course, you'll be notified and you will come straight here and take a look at the video. Happy New Year in advance to all of you, my subscribers. Today is the last day of the year, and since I started uploading videos from the 1st of January till now on the mental health nursing Osce, I've had a lot of questions in the comment sections, as well as a lot of people also thanking me for the videos that I have been posting, because most of them, or most people that are preparing for their mental health Osce, usually come here to look at the videos and then they use them to prepare, and I'm very much happy that my videos have helped them and they've been able to pass their Osces on the first attempt. In today's video is going to be a very simple video. What I'm basically going to do is that I have gone through all my comment sections, and usually people do ask questions under the comment section. So I have basically compiled these questions and I'll be answering them. I normally do this on the YouTube shorts, but not a lot of people are aware that YouTube have shorts. So probably if they ask the question and then I answer it using the YouTube shorts, most of you do miss it. So that is why I want to do this general video, and then we'll look at the questions that you have asked under the comment section and we'll answer them. If you have not joined my WhatsApp group, the link is going to be in the description. Just click on it and then it's going to send you to the group. In the group, I normally try as much as possible on weekly basis to post a question of the day, which is about the mental health Osce. People do ask questions there, and then I also answer in that same group. And sometimes when I want to do freebies, like this Friday 3rd of January, I just try to set up a Google Teams section where we get to ask questions on the mental health Osce. So feel free to click on the link in the description to join the WhatsApp group. Without wasting much time, let's go straight into it. So the first question that I get on the page or on this channel is the adult nursing Osce the same as the mental health? Of course not. The adult nursing is not the same as the mental health nursing Osce. There are some stations that are, there are some stations in the mental health Osce that you can find in the adult nursing, or they cut across, but they are not the same. So the mental health nursing Osce is not the same as the adult nursing Osce. A lot of people have kind of watched a lot. They are mental health nurses. They are preparing for their mental health nursing Osce, and they have watched adult nursing videos, and at the end they go and then they realize that it's completely two different things. So they are not the same. Is the Osce difficult? This is a question that is a bit relative. It all depends on how prepared you are. Honestly speaking, the mental health Osce as compared to the adult nursing, in my view, I would say that it's a bit difficult than the mental health Osce, because the mental health Osce is quite simple and it's not as complicated in terms of the individual stations as compared to the adult nursing. So the mental health nursing Osce is not difficult so far as you have adequately prepared for it. Then how many stations do we have in the mental health Osce? We have 10 stations. So there are 10 stations. We have the API, which is the assessment, planning, implementation and evaluation. Then we have 6 skill stations, which is IM injection, de-escalation, talking therapy, reminiscence therapy, nutritional assessment, evidence and physiological observation, and out of these 6 you'll be getting 4. And then we have the professional values and then the evidence base, which cuts across all the pathways, whether you are doing adult nursing, whether you are doing learning disability, it cuts across professional values and evidence base. So there are 10 stations, and in order for you to have passed this particular OSCE, you need to pass all the 10 stations. So anytime you are doing or you go in to do your OSCE, you do these 10 stations, you have to pass all before they they are going to recognize you as you have passed the OSCE. If for one or two reasons you fail any of the stations at all, you have to re-register and go and take that same station. I think that's a good thing about the OSCE. You don't have to do the whole thing again, but those stations that you failed, those are the ones that you would be doing. And then in the assessment, people are still asking, is it still on mania and depression? Yes. So as at now, 31st of December 2024, in the assessment station of the mental health OSCEs, either you are getting a patient who will be presenting as a manic patient, or you are going to get a patient who will be presenting with depression and suicidal ideation. So these are still the only 2 phases in the assessment that we have. And then the next question is it only psychotropic medication or psychiatry medications that you will be serving in the implementation? Of course not. You'll be getting some psychotropic medications depending on what phase you are getting. If it is mania, maybe some mood stabilizers. If it is depression, suicidal ideation, maybe some antidepressants. But alongside that, usually you also be given some physical health medications to also administer. When we look at mental health in general, most mental health patients also have one or two physical health problems, or even the psychotropic medications themselves. There are some physical health medications that they are going to give you, so that it's going to help with the side effect. We all know that most psychotropic or antipsychotics might let you put on weight. So as a precautionary measure, usually the psychiatrist might add some medications that can help to regulate your weight. So yes, in the exam situation is the same. You might get some psychotropic medication and some physical health medications as well. Do I need to read out loud the scenario? This is one question that I keep getting on most of the videos that I post. The scenario is actually for you, the candidate. It is for you to read, to understand. The assessor already knows the scenario, he knows what you are going to do. The patient knows, the patient that they've brought to act knows exactly what he or she is going to do. So the scenario is for you. You are supposed to read it in silent to understand exactly what you are about to do. And if you understand it and then you are ready, you straight away start the station. So you don't need to read the scenario out loud to the hearing of the assessor and then the patient as well. Then the next question is, how many silent stations do we have in the mental health OSCE? So we have 3 silent stations. The first silent station is the planning. So when we talk about silent station, they are basically stations that you don't need to perform anything for the assessor to see, or they don't necessarily have to give you a patient to talk to. So you just go in, they give you a scenario, and you have to present your answers on an answer sheet. Then you present it to the assessor, and based on the answers that you have presented to the assessor will mark and determine whether you have passed that station or not. So you basically sit and write your answers. That is why it is called a silent station. So there are 3 of them in the mental health nursing OSCE. Within the API, we have the planning, which is a silent station. You just write out your care plan. And then when we go to the professional values and evidence base, these are also 2 silent stations. Initially, de-escalation used to be a silent station until the changes that happened in September. Now you are given an actual patient for you to de-escalate. So as it stands now, the silent stations in the mental health nursing OSCE is just 3. Now let's go on to the next question, which is, do we do physiological observation in the assessment? The answer is no. It is adult nursing that they do physiological observation, but in mental health nursing OSCE, you do not do physiological obs, or in other words, vital signs in the assessment station. Physiological observation or vital signs is a scale station. So when we go to the scale station, it is a scale station on its own. So you do not do that in the assessment. Then people have also been asking about the major changes that did happen after the September 2024. You know, they did some bit of changes to the Osce, mental health Osce, and even in adult nursing, they did a bit of changes. But because we are talking about the mental health Osce, within the mental health Osce, there were just basically two changes. The very first one is a scale station, which is suppository, has been replaced with IM injection. So you don't do suppository again as a scale station. You will now do IM or intramuscular injection as a scale station, and I have a video on this on my channel. You can have a look at that. Then the next one is de-escalation. De-escalation, as I said earlier, used to be a silent station. You sit down, you write out your answers, and then at the end you present it to the examiner, and the examiner is going to mark it. But at a stance now, they are going to give you a patient who is actually agitated or anxious or has escalated, and you will have to verbally de-escalate these patients. In some situations, if there are no patient, the assessor could be the patient, and then you have to de-escalate the assessor. So yeah, these are the two major changes. Aside this, there was not any, just a bit of tweaking around. When you look at the marking criteria, they kind of change the languages with regards to some of the stations, but basically the procedure still remains the same, with the exception of these two that I have mentioned, that there were major changes. I will also attach the link to the updated the updated modification or changes that they have done. I've had people that come on the channel and they're like, where are you getting these from? The fact of the matter is that we know that within these universities, Northumbria, Leeds, these are the centers where you go to write. But the unfortunate thing is that after the changes, you can only find it on the NMC website. When you go to these centers or these universities' website where where they are classified as the centers, it is still the old materials that you can find on the website, which is really worrying, because once they've made the changes, then the universities or the center should also update their documents that they have there. But it's quite unfortunate that if you go there, you are still going to find this old material. So unless you go to the NMC website itself after the announcement, and as I said, I'm going to leave the link in the description where you can have access to it. When you click on the link, make sure that there are a whole lot of things that you can have access to. You can have the marking criteria, you can have the mock there, and then supporting materials. Supporting materials consist of all the materials that they've given you a sample of all the materials that you are likely to use in the exam situation. So you can also have access to maybe the news, something like the news 2 sheet, something like a nutrition, the sheet with which you're going to do your recordings, the PHQ9. These are all documents that you can have access to in on this particular link that I'll be sharing with you. I think aside this, most of the questions are more or less like they are related to this, or they are kind of a repetition of these questions. But as I've said from the beginning, if I've not answered any of your questions under the comment section, kindly make sure that you put your question there, and I'll make sure that I'll answer it for you. And please make sure that you subscribe to the channel. I was hoping that by the end of the year I could have reached 2,000 subscribers, but it's quite unfortunate. I'm still lingering around 1,600 and something. So please, let's make sure that we subscribe, and then we also share to other people for them to come and have a look at the channel. If they are preparing for their mental health Osce, it's really going to be helpful. And then if you want to also join the WhatsApp group, you can also find the link in the WhatsApp group. My relevant materials, you can also find a link to it under this particular description. I have the API booklet, and then the API booklet is what I have now. I'm currently making another booklet for the skill stations, where I'm going to have scenarios on all the skills that we have in the mental health Osce, and then probably a bit of description as to what is expected of you in the various stations in the various stations in the mental health nursing Osce. So yeah, basically this has been the video for today. I wish you a prosperous new year, and let's keep on learning, let's keep on practicing, and surely when we go to take our exams, I'm very confident that we are going to pass on one attempt. My name is Enos, and this is Work and Wonder. Until I see you again in my next video, it is a bye for now.